Brandis, a major hiccup today for one of the main COVID-19 vaccines. Out of abundance of caution, Illinois state health officials ordered all coronavirus vaccine providers to pause the administering of Johnson & Johnson's vaccine. This comes as federal officials review data involving 6 women who got a rare and severe type of blood clot after the one-dose vaccine. Earlier today, Chicago's public health commissioner spoke about the news.
With fewer than 50,000 people having gotten the J&J vaccine, and at this point the rate of this severe side effect that we're seeing is about 1 in a million, I would I would not statistically necessarily expect anybody in Chicago to have one of these events, but it isn't impossible.
And joining us to discuss this further is Dr. Emily Landon, Executive Medical Director for Infection Prevention and Control at UChicago Medicine. Dr. Landon, thanks for joining us again. So what do we know about these 6 reported blood clot cases tied to the J&J vaccine?
Yeah, so these women had a blood clot in the blood supply in the brain. Pretty significant. Symptoms are very similar to a stroke. These aren't the sort of blood clots that we see sometimes in women of the same age group where they get a blood clot in their leg or in their lung or something like that. These are a lot more serious, and they are related to a low level of blood platelets. And that suggests that there's an immune response against the platelets, which creates this kind of blood clot.
And for those that just received the Johnson & Johnson shot, I mean, you heard it's 1 in a million cases you're seeing here, but what would you advise those who might be worried right now?
First of all, you're more likely to get struck by lightning than you are to have this reaction to the Johnson & Johnson vaccine. It's literally 1 in a million, and everyone except for 1 was successfully treated. And so the first thing to do is to take a deep breath and do not panic. All of the cases happened within about 15 or 16 days of the shot being given. And they're still working out, trying to figure out who's exactly at the highest risk, which group is sort of going to be the most risk. And they're casting a very wide net. And so for right now, if you got Johnson & Johnson vaccine, if you have any symptoms of sort of numbness, tingling, stroke-like symptoms, or any trouble breathing, anything concerning, please call your doctor. They're going to be able to talk you through it and work with you. Chances are great, as Dr. ARWADY said, that no one that we know or no one in Illinois is going to have any of these side effects. Again, 1 in a million is so small. That should give everyone confidence in how incredibly careful our FDA and our CDC are in terms of watching what's happening with these vaccines.
And speaking of that rate, Dr. FAUCI addressed that earlier today. Let's take a listen.
There have been now 120 million people that have received at least 1 dose of a vaccine. Most of that, subtract the 6.85 million, is in the messenger RNA from Pfizer and from Moderna. There have been no red flag signals from those. So you're talking about tens and tens and tens of millions of people who've received vaccine with no adverse effect. This is a really rare event.
A very rare event, Dr. Landon. Why then, with only 6 cases out of 7 million, the pause here?
Abundance of caution and making sure that we can keep everyone's confidence in vaccines. To put this in perspective, there are tons of drugs on the market. Many people watching, I take a medication that has a serious side effect that happens much more frequently than 1 in a million. And I need that medicine for another problem in my life. And so I take that medicine. There are millions of people out there taking medicines like that don't ever worry about having that kind of problem. And so, but when it comes to a vaccine that's supposed to prevent something, it's best to know exactly what's going on before we, take a pause, look at the data, make sure we have all the information. And then I expect that we're going to see a more limited indication as they're going through the data. They'll say, for this group of people, we are certain that the Johnson & Johnson vaccine is safe, and so they can go on receiving it. Everyone else should probably get Moderna and Pfizer. That's probably what's going to happen next. And I think the best thing I can say is just please remember that this is incredibly low risk. It's not even clear that it's connected yet.
Dr. Landon, what does this mean for Chicago's vaccine availability and Cook counties in the state of Illinois?
Yeah, that would be a great question for Dr. ARWADY. It's going to set us back. We are definitely, there are a lot of places that are giving Johnson & Johnson vaccine. Johnson & Johnson is the fastest way to end up immune to COVID, which is really important right now since we have sort of a wave of infections coming our way from above us and from north of us. and from inside our own city. But I think the most important thing that we can do now is just get on the list to get a vaccine, get whatever vaccine you're able to get currently. Once Johnson & Johnson is back to providing the vaccine to, to whomever is at an appropriate risk level, please continue to trust. We are being extra careful and super careful.
And do you believe the Johnson & Johnson vaccine will eventually come back online in Chicago and around the country?
Yeah, absolutely. This vaccine is incredibly safe, with only 1 in a million people potentially having a reaction that may be related to the vaccine and seems to be in a specific age group of a specific group of individuals that we can take them out of the pool to get Johnson & Johnson vaccine. Once we can establish.
So are you saying women, I'm sorry, women between like 18 and 48, that's the pool there?
We would call that women of childbearing age. So
okay.
anyone, that's an age group where they're more likely to have autoimmune disease, more likely to have blood clotting, and that seems to be the same age group that we're seeing these particular clots. Now, others can get the clots, and they're going to have to search through all the people that have gotten this vaccine to make sure that there aren't other age groups at risk. But like the AstraZeneca vaccine in Europe is now approved only for people over the age of 50, because no one over the age of 50, or maybe it's 60 there, has ever had a bad reaction to it,
right.
and it works very well.
All right, Dr. Emily Landon, thanks for joining us as always.
Thank you.